Golden Notes. Dyspepsia. Dyspepsia describes symptoms such as discomfort, bloating, and nausea, which are thought to originate from the upper gastrointestinal tract. There are many causes, including some arising outside the digestive system. Heartburn and other reflux symptoms are separate entities and are considered elsewhere. Although symptoms are often correlate poorly with the underlying diagnosis, a careful history is important to detect alarm features requiring urgent investigations, like weight loss, anemia, vomiting, hematemesis, and or melena, dysphagia, and palpable abdominal mass. And also to detect atypical symptoms that might be due to problems outside the gastrointestinal tract. Dyspepsia affects up to 8% of the population at some time in life. Some patients have no serious underlying disease. People who present with new dyspepsia at an age of more than 55 and younger patients unresponsive to empirical treatment require investigations to exclude serious disease. In fact, there are many causes of dyspepsia, like upper gastrointestinal disorders and pancreatic disease, colonic carcinoma, hepatic disease, systemic disease like renal failure and hypercalcemia, drugs like nonsteroidal anti-inflammatory drugs, glucocorticoids, iron and potassium supplements, and digoxin. There are some others psychological like anxiety and depression, and also alcohol. So how to approach to dyspepsia? First of all, we ask ourselves, are there any alarms features? So if there are, then urgent endoscopy. If there are no alarm features, then if the patient is more than 55 years, then endoscopy. If he is less than 55 years, then we test for Helicobacter pylori. And if it is positive, then we treat Helicobacter. And if it's negative, we treat symptomatically or consider other diagnoses. We should remember some important list of drugs causing dyspepsia, like NSAIDs. We should remember here that ibuprofen is associated with the lowest risk of peptic ulcer disease. Also bisphosphonates, steroids, and the following drugs may cause reflux by reducing lower esophageal sphincter: calcium channel blockers and nitrates, and also theophyllenes. We should remember that the cause of dyspepsia, gastroesophageal reflux disease, 15 to 25%, gastric and duodenal ulcers, 15 to 25% also, and stomach cancer, 2%, and the remaining 60% are classified as non-ulcer dyspepsia. So what are the indications for urgent referral for an endoscopy within 2 weeks? Dysphagia, upper abdominal mass, any sign of chronic gastrointestinal bleeding, persistent vomiting, iron deficiency anemia, suspicious barium meal, progressive unintentional weight loss, and patients who are more than 55 years who've got weight loss, and any of the following: upper abdominal pain, reflux, and dyspepsia. Now, non-urgent, patient with hematemesis, patients aged more than 55 years who've got treatment-resistant dyspepsia, or upper abdominal pain with low hemoglobin levels, or raised platelet count with any of the following: nausea, vomiting, weight loss, reflux, dyspepsia, or upper abdominal pain. Nausea or vomiting with any of the following: weight loss, reflux, dyspepsia, upper abdominal pain. Now, managing patients who do not meet referral criteria, the undiagnosed dyspepsia, this can be summarized at a stepwise approach. Review medication for possible causes of dyspepsia, lifestyle advice, and the trial of full-dose proton pump inhibitor for 1 month, or a test and treat approach for Helicobacter pylori. The lifestyle advice: avoid known precipitants like smoking, alcohol, coffee, chocolate, fatty foods, and being overweight. Raising the head of the bed and having a main meal well before going to bed may help some people. Testing for Helicobacter pylori infection, initial diagnosis. In fact, NICE recommend using a carbon urea breath test or a stool antigen test or laboratory-based serology where its performance has been locally validated. Test of cure, the carbon-13 urea breath test. Now, cognitive behavioral therapy and psychotherapy may reduce dyspeptic symptoms in the short term in individual people. If Helicobacter pylori has been excluded and symptoms persist, then offer either a low-dose PPI or an H2 receptor antagonist for 4 weeks. Now, this was provided by the SSSM Study Smart series for Mrcp, your easy way to easy pass. Remember that the references and sources for the Golden Notes are Davidson, Oxford Handbook Series, Essential Revision Notes for Mrcp, and Notes and Notes. Don't forget to follow us on Facebook, Telegram, and YouTube channel. And remember, with the SSSM, you're always in a safe zone and you're always the winner.